Around 23% of Delhi's population could have been infected with coronavirus till the first week of July. A serological survey covering over 20,000 people across the capital 11 district between June 27 and July 10 showed, while also pointing to a large number of infected people being asymptomatic. The findings of the survey conducted by the National Centre for Disease Control along with the Delhi government were released on Tuesday. More than 23% of Delhi's 1.9 crore population showed evidence of past exposure to SARS-CoV-2, which causes the coronavirus diseases, in almost 6 months, and that a large number of infected people remain asymptomatic. The result of the sero-prevalence study conducted in the national capital shows. The Union Health Ministry said in a statement that 21,387 samples were collected in accordance with laboratory standards and were tested between 27 June and July 10 to determine the extent of the spread of the coronavirus disease in Delhi. Nearly 6 months into the epidemic, only 23.48% of the people are affected in Delhi, which has several pockets of the dense population. The Union Health Ministry, which commissioned the study, said in a statement. The seroprevalence study was conducted jointly by the National Centre for Disease Control (Ncdc) and the Delhi government, following a rigorous multi-stage sampling study designed. Blood samples were taken from randomly selected people as a part of the survey, which involves rapid tests for antibodies to study the scale of undetected infections. The samples were tested to ascertain the population level prevalence of the concerned antibody, which indicates past infection. Reacting to the development, the Health Ministry said in the statement, this can be attributed to the proactive efforts taken by the government to prevent the spread of infection, including prompt lockdown, effective containment and surveillance measures, including contact tracing and tracking, as well as citizens' compliance to COVID-appropriate behaviors. The ministry, however, warned that a significant portion of the population is still vulnerable. Therefore, the containment measures need to continue with the same rigor. Non-pharmacological inventions such as physical distancing, use of face masks, cover, hand hygiene, scarf etiquettes, and avoidance of crowded places must be followed strictly, it added. A diagnostic method, a serological test, are used to identify antibodies which are created by the immune system when someone is infected with the virus and antigens in a person's blood. Serology or the antibody tests are largely used for surveillance among the communities and can be used on people who have already been tested positive for the virus or even those who are asymptomatic. Epidemiologists often use serological surveys to determine who has antibodies and find out who has been infected with the virus, even if someone never reported a positive test or experienced symptoms. Bureau Report.